Hey everyone, welcome to this audio podcast. Within this series, as part of this series, the Assay edition, and this audio podcast series as part of the Biomed Monster. This is an audio podcast as a part of an evidence base and part of an audio podcast within this assay as part of the assay edition and part of another Storm Robotics production. In this audio podcast, in this audio podcast, there will be an overview in around the synopses around this series, and so and so um, and so. Within as part of this audio podcast, the series will have several sort of abstracted overviews in context of retrospective research, and so in a little bit more sort of overview as thus. The provision of educational support can improve patient care, but there has also been disparities between patients who are self-motivated to navigate elements of healthcare and those who seek out understanding and yet have little desire to becoming self-empowered. The role of point of care education, or POCE, and online consultations for nephrology recipients or patients or service users through online support groups. Is through this works or this through this series is contextualized, highlighting sort of reflections and contemplations surrounding eight specific publication outputs and outlining some conclusions. So the aims and objectives at the same time. The publication outputs are thus number one, how young people cope with CKD in context of a literature review from 2012. The Lord Mayor of Bristol's blood and organ donation campaign from 2015. Number three, coping in young people with CKD in context of original research from 2015 to 2016. The number four is where the series generally highlights an overview in around service evaluation for young people suffering with chronic kidney disease from peer review in context of peer review works from 2018. Number five is in around a need for healthcare scientists and educational support surrounding CKD from peer review works from 2020. Number six is in around healthcare scientists and primary care in context of a systematic review from 2020 as well. And in number seven is around peer review works around education, empowerment, and practice excellence, and practice review from a practice review paper from 2021. And eight, educational support surrounding CKD or chronic kidney disease, a qualitative inquiry, wherein this work is sort of anticipated as a sort of publication in around this year, in around 2023. Within the critical overview, in context of this works, there is an overview that summarizes a list of publication outputs and an overview that summarizes the list of statement of author and co-author contributions where applicable. Now, as part of this synopsis, to highlight that the table, the overviews in context of the appendices or appendix, so to allude to, are not included in sort of the overviews in around the audio podcast or the series. However, the works would be made available through our collaborators, the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS for kids, in due time. However, at the same time, there are also overview in the written overviews of this as part of this, aligned to the abstracts that have been sort of highlighted. The full document or critical review, if you like, also includes a few schematics that that sort of highlight an educational, for example, an educational pathway for CKD patients or service users, and service providers, and also a second schematic that highlights that proposes a guide or an algorithm to assess CKD service users or patients for advice and educational support, integrating between electronic patient records (EPRs) and online spaces. And this research, the critical review or the research informs that co-developed point of care education and educational modules should be co-developed and sort of delivered between service users and service providers, and these can be linked through patient, for example, online patient organizations, and integrating the CKD care pathway, so that public health awareness and research meet practice excellence. So that draws this synopsis to a close, and the series is the series in around this sort of radio or broadcast edition as part of this audio podcast series, part of a radio or a broadcast edition, and being the Assay edition. This is an audio podcast series available through Storm Robotics production specifically, and across different social media platforms, and within social media or on social media, there will be some citations in regard to the original peer-reviewed works, and will be accessible through the Renal Patient Support Group, or the RPSG, sort of collectively. So thank you for tuning in. This has been an audio podcast as part of the Assay edition, part of an evidence-based perspective, and also an audio podcast as part of an Assay edition, and as part of the Biomed Monstar, and as part of an audio podcast as part of another Storm Robotics production. Thank you for tuning in.